the phones in the house, because I am literally shaking uncontrollably with the phones and the masks. They're driving me and my family out of our minds. And all these other people. In fact, Margaret Cousins, who lives in Wexford, I had to phone the Wexford County Council the other day because she wanted me to come down and sit with her when she committed suicide. And I myself have sleeping tablets in the house. Because it's so bad, sometimes the sensation from it is buzzing through your head. The waves from the microwaves are affecting you. They're affecting the body continuously. And the brain, the top of my head, my brain is continuously pulsating. I mean, I can't stop it. I phoned them and I asked yesterday even, I couldn't get up in the chair, and I pleaded with John Moore in Comridge to turn the power down. Turn it off, turn it down. He said, no, I can't do it. And I'm phoning him every second day, pleading with him, as all the others are as well. And he said, there's absolutely nothing we can do. I said, you know, we're sitting in our houses dying like this, and you will do absolutely nothing to help us. He said, no, there's nothing we can do. So, I mean, who do we go to? Who do we plead with? I mean, even I went to the Garda station and I told them that I have to go into the bus lane because I can't. If I go outside my door, it's outside my door, it's on the Garda station, it's on the train station, it's on the coffee shop, it's on the bowling alley, it's all the way down the road, so it's hitting me all the way. And the guard said, I went up to the superintendent and I let him see how bad I was, because when I go in, my sight goes down with it, my vision goes down. My head is pulsating and I become extremely hoarse. And
I'm going to have to try and move on.
If we could just establish, does it help if the power is reduced? I mean, you're talking, John Cummins, if you're saying about other countries and and that we have much higher levels. I mean, is it something that we should be looking at as a health committee to actually to reduce that? Yeah.
It would, because it would reduce the intensity of the signals. If the signals are very strong,
it
attacks your whole immune system.
Okay.
So the stronger the signals, the more. I said, just to give an illustration, we wanted, as I know, even there's a copy of something we have to get for your bedroom to shield out the microwaves, the high intensities.
Yeah. No, but I mean, I'm just saying for your own benefit. You're talking about your personal cases, and they're, you know,
I know, but
they inform us.
The country.
But I mean, I think as a committee, what we're trying to establish is just what we can do.
Yeah, well,
what I feel is that we need, you know, they're not taking the masks away. They're not going to take the phones away. Okay, and I can understand that. We need screening.
Sorry, can I just say to Helen, can I just ask at this point, we have to try and move on. I'm going to ask you to send me in your recommendations of what you want us as a committee to pursue. There are other groups here that I've kept waiting and I have to try and move on.
Yes. I'll give you this.
Okay, we'll take the recommendations from you.
From our John Gormley. Recommendation here from our group.
Sorry, Fergal Brown.
I think as a follow-on.
You said you need a screen, is it?
People who are affected, and this is the same with Margaret Cousins, this lady that's suicidal as well, is that the people who are feeling it to this degree, who are sensitive to this stage that we can't cope with it, we need screening we need our houses screened. In fact, I asked Tom McManus, would they screen the houses? And he said, well, he looked at the other guy and said, well, do you think that would help? And I said, absolutely. Screen our houses because they're not going to take the phones away.
When you say screen your house, what do you mean exactly?
When I first came down with this, there wasn't anything available really that you could screen a house with.
Yeah.
But
I believe they're already doing that in Sweden.
Yeah, they're doing it in Sweden. They have special houses in Sweden for people like us.
And can you have zones like that? You know, like years ago, like before the public smoking ban, you know, you'd have non-smoking and all the rest. Is there any zone?
No, there isn't even. We should have a place for respite for people that are coming down with this, that they have places to stay. We need screening in the house. They have it in Sweden. The hospitals are screened, the houses are screened. If that doesn't work, they take them out to the country to cottages. And we're sitting with nothing. We can't get this help, you know?
Can I just ask you a question?
Yeah. Sorry, Dr. Devlin, could you hold you 1 second? There's a few questions I need to bring in first, as you've indicated. Fergal Brown, Podge Connolly, Dr. Devlins. As a try and move on.
I think as a follow-on to this meeting, we should definitely invite in Comreg before the committee. And just, can I also ask, am I right in getting the impression, and this has been my own experience too, people have felt that Comreg were brought out to monitor emission levels, and the emission levels that were found were according to WHO standards, but there was an impression felt or created that the companies were aware that Comreg was going visiting and turned down the emissions in advance. And that's what makes it so difficult for us as politicians, because when we ring up Comreg, we're told, we visited the site, we checked the emissions, we were told they're X, Y and Z, this complies with WHO, but yet on the ground we're hearing a different story. And that's where the grave difficulty is, but it's only carrying out 10 inspections a year.
Sorry, they've done for 2005. They did a pilot project in 2004, but in the year 2005, from January to November, there was that number done. And Cormac will come out and give you a report saying that there are thousands upon thousands of times under the guidelines. But if you go to the guidelines that I mentioned, other European countries, there'll be